Hello, my name is Bobbi Schmidt. Currently, I'm the director for home care for Horizon Home Care and Hospice, which is located in the southeast corner of Wisconsin and includes Milwaukee. I've been with Horizon for 5 years. Prior to that, I was with a hospital-based home care agency where I was a field RN. For about 7 years of a field RN, I then became a director for home care for an additional 8 years. In total, I have about 20 years experience in home health care. The biggest differences are reducing the visit frequency for some patients and, of course, wearing a lot more PPE. Regarding our office staff, about 75% are working from home. The staff that remain all wear PPE when walking around or when they're within 6 feet from someone else. The PPE for the office is a basic fabric mask. We have also stopped some non-essential visitors, including our vendors, from coming into our building. Our referral mix has changed a bit as well. Therapy-only patients have declined. Some WCCs have been closed or limited their hours. We've also seen some clinics stop referring to home health until local restrictions are lifted. I think it's important to know how many home health agencies are still open and accepting new patients. Our intake department is working closely with these clinics to help provide continuity of care for their patients. Home health agencies are the best option for keeping patients out of the hospital. Yes, they have. The temporary CMS loosening of patients who qualify for home health care has helped us and our patients. It allows us to treat more patients in the community who may be experiencing limited access to doctor's offices, including the WCCs, and who want to avoid going to the emergency room. We are also looking to help doctors with virtual visit. The permanent CMS loosening of who can authorize home care include the non-physician prescribers, or NPPs, is also a positive change. It allows us to work more closely with the nurse practitioners and physicians and assistants regarding that patient's wound care. COVID patients are usually identified by the referral sources, but we do screen every patient before every visit by asking a series of questions. Originally, it was a travel screen, but with community spread, we now ask about fever, cough that is new, shortness of breath, getting in so deep as to ask about a sore throat, loss of sense of smell or taste, including asking what others in the home may be feeling or not feeling well or have potential symptoms. For all patients' interactions, our nurses use surgical or fabric masks, glasses, or goggles. For the COVID positive patients, until no longer positive, we adhere to the CDC guidelines for the PPE. We don't end off outside the home if the weather permits, or don't end off just inside the patient's home. In terms of how patients are being treated, it's really no different except for some of the communication challenges that we find with wearing that additional gear. Part of my role as director is to educate the agency about effective product offerings. I find it effective to send out weekly reminders to the nursing staff. For starters, it's important to remind our nurses about the KCI Ion Healing mobile app, where they can connect with their local rep, order products, and watch tutorials. In fact, just the other day, one of our RNs worked with our rep to order V.A.C therapy for a patient. It was a pretty sweet ride for that patient to get that immediately. V.A.C therapy is a great option for many patients, not only because it's the gold standard in negative pressure, but also because it helps reduce the frequency down to 3 times per week. Another great NPWT option is the S.N.A.P therapy system. To keep this product top of mind, I send out Snapchats where I remind our nurses about the benefits of the S.N.A.P therapy system. This option provides our patients with the proven benefits of NPWT without waiting for the supplies because it's off the shelf, meaning we have it in our inventory. We like it, and frankly, the patients do too, because it further reduces the number of visits down to 2 times per week, and it's covered by most of our patients' insurance plans. It also reduces the pressure of our nursing staff because we have 24 hours to resolve a dressing issue if the patient is not able to troubleshoot on their own. I recommend asking your local rep to assist, even if virtually for that first-time application, since it's a little different than the V.A.C therapy. In terms of advanced wound dressings, we use Chromogram Prisma Matrix. because of the extended wear time and the ability to handle exudate. Chromogram Prisma Matrix is easy for our nurses because it's bioabsorbable, so nothing to remove. I would answer this question in two ways. First, is the day-to-day clinical support we need to care for our patients. The fundamental need hasn't changed, but the method in which we receive education certainly has. First, we rely heavily on virtual training, both on-demand and live video interactions. On-demand is great for when there's a specific topic the nurse may like to information on. Live support is important when we have a question about a specific product or a wound. Our local 3M KCI rep is only a FaceTime away, and we can request his support through Ion Healing mobile app. 3M KCI also offers live pre-scheduled virtual in-services where the nurses can ask questions and engage with the clinician on the other end. The second need for education is a bit more unique due to the COVID-19 situation. When one of our nurses has been at risk for exposure to COVID-19, they are required to self-isolate for 1 to 2 weeks depending on the situation. This is a great opportunity to catch up on education and earn CME credits. We have an in-house LME platform nurses can use. They can also take advantage of the educational offerings from companies like KCI 3M to learn product-specific information. Nurses can also earn CME credits on the 3M KCI sponsored webpage of NACCME called the Center for Healing Solutions. We have found that we need to train more patients, family caregivers on their wound care. This reduces the need to have someone from outside coming into their home as often. And interestingly, the patients and family members are more engaged than normal in learning because they too want to limit the number of people entering their home. For wound care specifically, I recently learned that 3M KCI has added a whole bunch of content to their patient-centered website called mywoundhealing.com. First is to be kind. Understand your staff is under additional stress due to their fear of becoming infected and possibly transmitting the virus to their family. Inform and educate. Communicate frequently to your clinical staff and the patients we serve. Thank you and stay safe.